because it's nursing school. It's just back to school season. So I want to talk about nursing school, right? But I don't want to talk about, I mean, you've got enough information. I scroll through your episodes, right? But the most recent one, you talk about the roller coaster of nursing school, right? And it is so true. So I don't want to rehash anything you did say during that the podcast. So everyone, if you want to hear a comprehensive look at what nursing school is like, not talking about
part two coming this Monday. So part two of that episode is coming out. So there's more roller coasters. There's 2 roller coasters.
There's 2 roller coasters. What's it called? So if you want a comprehensive look at it, and I'm not talking about the details of like, I mean, they do. You guys actually do talk about like getting homework done and like setting all that stuff up. But like, I'm not talking about like the actual science behind what does this med do or what does that disease process do. They talk about the generalities of nursing school. But I want to talk to you about the tension between nursing students and nurses, nursing. Like, I have had the smoothest sailing once I became a nurse. I found that I had the most tension with other nurses or like people in the profession while I was a nursing student, during clinical, during my rotations, with my nursing professors. Everything seemed like there was so much tension all the freaking time, right? And it is a totally different switch from your prerequisites to being a nursing student. Like the whole critical thinking aspect, all of that stuff is very, very heavy. But I have not been more stressed in my life than being a nurse. Which is crazy to say that day to day I deal with dying patients, but nursing school was the most stressful thing for me. Can you just talk to me a little bit about that entire process?
Oh my gosh. I will say, like I kind of alluded to, I was a non-traditional student, so I had a little bit more up and down of the roller coaster. But the whole reason I started Nursing Uncensored was because I didn't feel like people were talking about that moment of like, you start nursing school and you go from taking like your prereqs and you have homework and like it's good, like you can manage. You have to work hard, but you can do it. And then you get to nursing school and you have multiple classes, labs, clinicals, your job that you may or may not be working, the fact that you have to, eat, sleep, poop, see your family
on top of all of the nursing. When does this happen?
Yeah, right? And really all you want to do is lay down and go to sleep. Because in your waking hours, even if you're only in class, it's like information pounding. It's like being slapped in the face constantly with information. And then on top of that, so like now if I go in to do, like say I go in to straight cath a patient and you use sterile technique and you have to watch your sterile technique. If you break sterile technique, it's on you to make sure that you get a new kit and you start over so you don't get that patient a UTI and you don't get them septic. It's your process. When you're in nursing school, they give you, I don't know, I assume all schools do this. They give you like the list of steps in order, but it's micromanaged. You get a point for everything or a point off. You have to knock on the door, introduce yourself, wash your hands. These are things that we do subconsciously every day with every patient. And so when you're being tested of like, okay, wait, do I knock on the door and then wash my hands, or do I wash my hands and then go in the room? And so you start to like, I think that's where my anxiety as a new nurse came from, because I was like, oh my God, did I lose a point because I said the wrong word? Like, did I push the wrong button on the IV? Was I supposed to hold it like this? Was I supposed to hold it like this? Like what? You become so hyper focused because someone is watching you and they're like, oh, your pinky finger touched outside that sterile, and you're like, oh God, oh. So I think that there is this level of like panic that happens when you get into nursing school and you realize that you're not just like a student that's learning, but you have real people on the other side of the, eventually. That's why they start you off on the fake arms,
right,
and like the dummies, like, because eventually the stakes are going to climb. And so from the first lab where you're like, oh my God, I don't have, that's the other thing is like, you don't have, it's like a hairdresser. You have to know how to hold a bunch of things at once. And so those things that you don't have as a nursing student become stressful. Like I'm
that
fumbling.
Finger dexterity is something you learn. You have to learn.
Like how do I switch syringes without like having to scrub my hub again? Like I've got it down to a science. So I like joke with my friends that are hairstylists. I'm like, we should have like a contest on like who can do the most shit.
More. Yeah, that would be interesting.
but you have this transition, and the stakes are higher, and you don't want to have to repeat these classes because they're so fucking hard in the first place. Like,
Oh,
really,
forget about it.
I had a classmate who had walking pneumonia for an entire semester. They ended up failing that semester because, well, they had walking pneumonia. They were doing clinical, they were working, they were doing classes. That person failed that one class, so then they make you repeat the whole semester. She had to repeat 180 clinical hours in like her semester. So she did that twice. So essentially to get her nursing degree, she did like close to 300 clinical hours when the rest of us just did it once through. So there are high stakes. And you think to yourself, oh, I got a bad grade on that exam. That's when you start calculating, okay, I can miss this many questions on the final if I want to like continue moving forward. There's all this pressure.
It's so much stress.
People that are like, are you done with nursing school yet? And you're like, I don't even want to tell you how I'm doing, because so that role transition from prereq student to nursing student is huge. And I do think it's harder because once you get into your job, you don't have that person that's like, you didn't wash your hands for 15 full seconds. You only did it for 12 seconds. Like, okay.
Relax.
Yeah. We all need to stay on top of our game, but I do think it's very different. And I think that students aren't warned about it. And I don't think nursing school does an ample enough job warning you about how you're going to feel when you get out of the clinical, out of the lab, and now you're in patient care and you have nurses that are in, that's the other thing I wanted to say. In my own hospital, I've never had any nurses that were bullying or treated me crappy or like didn't try to teach me.
Nothing?
Not at my hospital, but I've done clinicals at many other hospitals, and I myself, as well as my classmates, have had that nurse that's like, she doesn't let me touch anything, she doesn't let me do anything, she doesn't let me see anything, she acts like I'm annoying, she goes into rooms without telling me, like I feel like I'm chasing her around like a puppy, and now she's more annoyed because now I'm like asking if I can do. So that does happen, and I'll say this concisely because I think I've touched on this a little bit within an episode. First of all, if you have a clinical instructor or a preceptor or a nurse that you're following that is bullying, it can be scary as a student to speak up because you're surrounded with that nurse and her coworkers and you don't know where their alliances lie and if they're going to throw a student under the bus. But if it really is bad, you don't deserve, even as a student, you don't deserve to be treated like shit. You don't deserve to have your learning infringed upon because they won't let you do anything. If they have concerns about your performance and your safety, that is the responsibility of the nurse that you're following or your clinical instructor to address, okay? But if you're not doing anything dangerous, you're not being a cocky, arrogant student, then there's no reason that you should be treated as anything less than an actively engaged student. Not all hospitals like that. Not all nurses sign up to be teachers. Sometimes they come in that day and they find out they've got a student.
Right.
But I say, suck it up. You might get a patient you don't like. You may have to talk to a doctor that's mean to you. We all have to do things that are unpleasant. So why make it worse for somebody else?
Exactly.
So I say to those preceptors, tell them you don't want to precept anymore if you don't want to do a good job of it. And if you're a student, don't take abuse and don't take shit. But if you have to go and say, hey, my preceptor, like I wouldn't recommend going in and being like, oh my God, that person sucks and they're mean to me and I hate this and I want to know. But go in and say, I have concerns. This is how I've been feeling. These are the things that have made me feel that way. And while I'm happy for any opportunity, this opportunity I feel is like not right for me, or it's not working, or I'm not learning, or whatever. Hopefully your school is receptive to that. However, I also think that it's your responsibility as a learning student that you show up prepared, you show up proactive, you show up to ready to communicate with your nurse and your patients. So I think there are responsibilities on both sides. But don't ever let someone make you feel like you don't belong there, or you are treated like shit, or you're abused, or like I've had students that have emailed me and been like, I heard the staff nurses like talking shit about me and my fellow students. We came around a corner and came face to face with them, like as they were saying shit. And
that's rough.
And it's a case by case. Like I can't just say, oh, well, you should immediately go. You got to go to somebody you trust. Don't gossip it all over your clinical group. Like just keep it to yourself. Be responsible about it if you want to have your your claims heard. Don't just like be inflammatory and yell and say you
throw
want
shit
someone
in
new.
the air and
Right.
start,
Like, don't talk about how horrible the nurse is. Like, don't do that. Just say, this isn't a fit. This isn't working. Like, this is how I've tried to make it work. It's just not working. I was able to switch from someone that was treating me. They weren't treating me badly, but they weren't really giving me the time of day. And I was like, I'm paying money to go to this school, and I don't really, even though I'm not getting paid at this clinical, I'm not paying money so that I can have someone make me feel bad and not teach me anything. Because then I'm going to graduate and I'm going to have a whole semester where I didn't learn shit. So be proactive.
Advocate for yourself as well.
You've got to. And if you see your coworkers talking shit about a student or like not teaching them or like leaving them behind, say something. Hey man, you want me to take that student in when I do my meds? Because it seemed, be nice about it. I get kind of snarky when I talk about stuff on the show, but just try to remember. Sometimes we forget that feeling of being new and being the new kid on the unit and what it felt like in clinical.
It's really scary. I mean, it is scary as hell to walk into a hospital and be like, all right, first day clinical, you guys gonna pass meds.
Like on my unit, we're a monitored unit. There are alarms going off.
Yeah.
Lights going off, people coming up to the desk. It's like stimulation.
You don't know anything. And people asking for you. It's crazy. It's crazy. It's crazy.